Hello, this is Dr. William Berger, founder and physician at Northeast Medical Practice in Great Neck, New York on Long Island. We are a primary care, weight management, and aesthetic medicine practice. So just wanted to take a few minutes to talk to you about an issue that I'm often asked about. So as we lose weight, we're always going to lose some volume in the face as well as elsewhere on the body. And as we lose volume in the face, if we're getting to be of a certain age, that's going to expose some changes that have been happening behind the scenes, if you will. So just briefly, from an anatomical perspective for aesthetic medicine, the face has numerous fat pads naturally that are underneath the skin. And when we're young, all of these fat pads are nice and plump and where they belong, and they give us that more youthful, full face. And as we age, these fat pads have the tendency to thin and descend, and these can cause the development of some of the lines that we may not be so happy with. So nasolabial folds, the marionette lines, jowling as well, and just general sagging of the cheeks and so forth are all the result of this natural process. Also, there's some bone loss going on in the face as we age, just like we lose bone density elsewhere in the body, and this also exacerbates and worsens these particular lines. The nasolabial folds are often caused by loss of bone behind them. So what can we do about this? Well, whether you've lost weight and now these things are more apparent, or they're simply becoming more apparent and you'd like to deal with them, one of the great treatments that I offer here in the office is dermal filler. So dermal filler, whether it's made of hyaluronic acid, which is a natural component of the skin, or other materials, can be used to replace that volume that we have naturally lost due to the aging process, and as I mentioned, which could be exposed more so now because we've lost weight in general, which we desire and has so many medical benefits, but it can make these changes more apparent. So I'm highly trained in aesthetic medicine with some of the best trainers and clinicians in Manhattan as well as Toronto, Canada, and I provide this service, this care for many of my patients, and it's very much in the news and on social media and so forth about how rapid weight loss, in particular with some of the newer injectable medications like Ozempic, Wegovy, Mounjaro, and Zepbound, can really make these changes of aging of the face more obvious and apparent. So that's one of the great treatments that I offer to correct for that. In addition, our weight management program, for those who are enrolled in that, there's a 10% discount on that treatment, but also I've elected to give 10% off on all of the aesthetic medicine and esthetician services that we offer here. So I also perform neurotoxin, so that's Botox, Xeomin, or Dysport, depending, which can be used to help control the lines that wrinkle the forehead, appear between the brows when you frown, or the crow's feet that can appear when you smile or squint. And also we offer esthetician services in the office, which include basic facial microderm abrasion and chemical peel, and these can also help with maintenance and restoration of the youthful nature of the skin. And of course, I offer as a primary care physician also general treatment for skin conditions that affect the face, such as rosacea, acne, and so forth. So if you have interest in addressing these issues, which also affect people's confidence and thus their mood and so forth, and really aren't just a cosmetic issue, please reach out to us. Again, we're Northeast Medical Practice. We're located in Great Neck, New York on Long Island. The website is northeastmedicalpractice.com, and our phone number 516-604-3418. And as always, the information I provide in these videos is only for educational purposes. We have not yet established a clinical doctor-patient relationship. And of course, if you have immediate issues with regard to any health problem, you should not hesitate to seek medical attention. So that concludes today's video. Thanks for your attention, and perhaps we'll see some of you in clinic soon. Take care. Bye-bye.